So just a bit of background to what I'm going to talk about today. I'm going to try and do as much as possible talking about the decline of public health in Liverpool, the sort of birthplace of it, the impact this has in terms of the creation of the National Health Service in the city, and what it means for people's health. And ultimately, I think in the current view of the situation, how this feeds into the real problems of the pandemic that we're living through at the moment, and a lot of the major problems that we've faced as a nation, but also the government over the last year, have ultimately reflected many of these longer standing issues. So although it says sociology, Lancaster University at the top, it's work that I did while I was at the University of Liverpool when I was a researcher a few years ago. But I was originally an undergraduate there back in 2005, and seeing a lot of those images that Aidan put up, it really took me back. So there's a longer span to be had here as well. So it takes in this older span of research. But first, so why am I talking the kind of controversial title, Managing Decline, to kind of talk about this? So many of you may be familiar with this, that in the 1980s, kind of the doldrums of Liverpool's economic and social fortunes, there was the Toxteth riots in the summer of 1981, and Michael Heseltine was charged with going in by Margaret Thatcher and having a report about the city. And Geoffrey Howe, pictured here next to Margaret Thatcher, in this report, so there was an argument within cabinet, he said that the Liverpool problem was too great and that basically the city should be run down. And he advocates this idea of managed decline for the city. And the reason that I've taken this concept or this tagline is because for me it captures two things that I'm really trying to convey throughout the whole time, even back into the 1800s in public health in Liverpool, is on the one hand that Liverpool is always viewed as a problem, a difficulty, this constant thorny issue by people in central government and power, really. And this has been a very long issue from sort of year zero. The other side of it, and I think the more interesting bit, is that this issue of managing decline, so these recurrent social, economic, cultural problems that are experienced in Liverpool, there's a group of people, particularly big public health leaders, who are responsible for managing and dealing with them, and it's those that I'm very interested in. So there's a real tension between what the people at the top and above see about Liverpool and what those that are responsible for managing and looking after it think about it. So how I'm going to run through this, I'm going to try and be as cursory as I can, but hopefully try and give you a bit of a feel for things. And I'm mainly kind of drawing on pictures, images, ideas to try and put this across rather than, gory detail, so to speak. So I'll split it in about 5 minutes on each, about the origins of public health in the city of Liverpool, running up to the end of the First World War and the influenza pandemic of 1918-1919, then this real peak of public health within the city of Liverpool after the First World War until the foundation of the NHS in 1948, then how the city and public health as a way of thinking about issues goes into decline with the creation of the NHS, the more recent past about what changes the NHS mean for all of this and the people of Liverpool, and then also the last bit sort of talking about the last few years in the NHS within health services and how they've kind of fed into a crisis really within health services that's then led to the situation in terms of the pandemic. So I'll begin at the beginning. Public health is synonymous with Liverpool because it had the first proper medical officer of health, William Henry Duncan, who was appointed in 1847 as a single official, although he was appointed with two others, to manage the health of the people of Liverpool. So although experts among you will know that this map is dated 1866 and Duncan left in 1863, it's indicative, I think, of this approach of thinking about the health of the public as a health associated with place, with people, with a whole range of issues that's born at this time. So rather than thinking about health in this kind of narrow term about doctors and medicine, health was a big, broad span. And so this map here from the cholera epidemic of 1866 is used to track and log cases in a way, that the test and trace system can only dream of nowadays. There's a way that they're trying to understand the spread of the disease, the kinds of people who are affected by it, the kinds of factors that cause vulnerability to the disease and prevalence. That basically the medical officer is responsible for the city, the people of Liverpool and their health as a whole. And this is something that's sort of taken forward because of the depth of problems that you can imagine. Liverpool during this period, it was expanding enormously, the amount of dock trade that's running through, that there are a range of health problems that Liverpool is at the real forefront of. And that's part of the reason why it's the kind of birthplace of old public health. I've got this map to try and, this image to try and show that health is in its broadest sense here. So if you go through the annual reports of the Medical Officer of Health for the City of Liverpool, and they get thicker and thicker and thicker as time goes on, you can see the kinds of things that they're responsible for. So in the days before they had, estates and housing, it was the medical officer who was responsible for the quality of sanitation, but also housing and accommodation, and seeing that a lot of the health problems that people suffered with and experienced were directly related to how and where they lived. And this was a reasonable thing for him to be involved in, and his sort of team of officials. So this is the kind of one that still lives on in the city of Liverpool. You can see this legacy today, but also things on a very mundane level, like adulterated food that's being sold. Things like sanitation, sewerage, that health is in its broadest sense. And a lot of the things that we kind of take for granted today were born during this period of time, and a sort of legitimate responsibility for the people in the city of Liverpool. So,
Michael,
yeah,
are you showing slides?
I am, yes.
There's none showing, there's none coming up.
Right, that looks okay. That's it.
You cracked it.
All right. So I'm going to go back. See the map, the glorious map, 1866 colour map. That my kind of sarcastic jibe about NHS test and trace. That here you've got a very real way about the spread of the disease, where cases are, where people are living, and you can see in a very real way in this annual report that they're showing where cases are, the incidence, the volume, the number, the spread. They've got a very strong understanding of these kinds of issues, even 150 years ago, in a way that in recent times it's kind of the capacity has had to be built back again. We'll come on to part of that in a bit. So this is the image of Hornby Street, which was a series of kind of pioneering apartments and flats that were part of the Medical Officer of Health's purview and their responsibility. And remember that Liverpool has the first local authority council housing in the country in 1869, St Martin's Field. So it's again a pioneer in this, and seeing that housing is the responsibility of and the function of the kind of medical officer, legitimate thing to be involved in terms of health rather than just hospitals. So this image is to show two things. That you can't see the dates just on the far side, but on the first bit you can see that there's a real shift in the 1860s running up to the turn of the century, where all of a sudden there's a range of statutory intervention by the government that sort of legislates for new kinds of infectious diseases, and they advocate building of hospitals, building of sites, new responsibilities based on the Liverpool model in many ways, to try and identify cases, people, and then track them down, and also isolate them from the wider population to contain the spread of these kind of old-fashioned epidemic diseases like diphtheria, scarlet fever, dysentery, a whole range of illnesses, and especially it being a port, you still get things like the plague coming through on a semi-regular basis. So there's a whole set of containment. The other side shows the medical officers of health. So if I was to show you, I don't know, Bolton or Bootle or anywhere else in Britain, outside of Liverpool, Birmingham, Manchester, you'll see a lot of names. But Liverpool is considered one of the top jobs to be medical officer of health. You go there with a vision to do something. You've got the resources, you've got the backing of the council in many respects. And that's why in this span of time, there are only 4 medical officers of health, and the period after, there's only 3. So in the whole time when they exist, there's 7 in total, because it's a high status job, because you're seen to be doing something. So the quote that I got at the bottom kind of gives a bit of the background to this. So the boss on my old job as Professor Sally Sheard at the University of Liverpool, and she wrote about this kind of origins of epidemic diseases and infectious diseases in the city of Liverpool just before the First World War. And she says that none of this, with the benefit of hindsight, should just be taken for granted. That it's not just history developing itself over time, but it's a political battle with the local authority that the medical officer wins, but also getting the money and finances to do it. And bearing in mind that Liverpool at this time is quite prosperous, there's got the port, it's the second city of empire, it's in a position to do something about it. And so this all sort of comes to a head in 1919. I've got these 4 images to try and capture this. So just after the First World War in Liverpool, famously, you have the centre of the police strikes, where, you know, tanks are deployed in mainland Britain, in Liverpool and in Glasgow. That this is again seen as a public health issue in many respects. The management of all of these kind of deserted areas that are left by the police and the rioters that move in, and the problems that arise as a result of them. And again, you go through the medical officer report that 1919, you know, it's a thick volume because it's a crisis year in many respects, coming out of the First World War. And the police strike is a part of this as much as these kind of classic pandemic problem of the influenza in 1819. And you can go again, and it's got the kind of lists month by month, week by week, the number of people who are affected, the number of cases. And this again kind of pushes Liverpool into the forefront of trying to, you know, close places down. Many of the restrictions that we're living through now, but not quite on the same magnitude, because it's still a wartime economy. And this is all the responsibility of one individual within the city. You've also got another set of riots. So the other image on the bottom left-hand corner that you can see is of Charles Wotton, who was a black seaman who was killed and lynched in the city of Liverpool in 1919 when there was a race riots that gripped the city during the demobilisation. And again, this is something that comes under the responsibility of the medical officer through his responsibility for shared accommodation, for lodging houses that sort of come at this time when most of the seamen are living. And then latterly, on top of all of this, in the summer of 1919, it's incredibly hot. There's a series of diarrhea, enteric fever and dysentery outbreaks among infants and young children in the city of Liverpool, which lead to record numbers of deaths since, you know, the 1880s, 1890s. So if anything, this kind of progress of public health, it's not sustained all the time. And 1919 really shows it as a crisis year. So if that's kind of medicine, then public health is kind of overall concept. It starts to change during the interwar period, because here you've got an image of what is now, can you recognize it scarcely, Broad Green Hospital, but then was Highfield Isolation Hospital and Tuberculosis Sanatorium on the outskirts of the city of Liverpool. Because during the interwar period, the local authority takes direct responsibility for hospitals, kind of acute caring and curing services in a way that it never has before. So it's always had this kind of isolation, TB, sanatoria, these kinds of broader public health, but curing medicine has never been a public responsibility. And this changes during the course of the interwar period. So as the public health is becoming part of this responsibility, there's receding into the background private health. So what you have is traditional curative medicine that dominated by, you know, the big teaching hospitals. And in Liverpool, there are dozens of these. There are over 20 in Big Report in the 1930s. And part of the reason that public health is stepping into this sphere is because of a failure of the private services, because they're running out of money, because it's reliant on big donations. And as the economic fortunes of Liverpool start to wane, so too the ability of the hospitals to run, because they're reliant on these kinds of sources of funding. So it's almost as if before the NHS, this real moment where local authorities, the medical officer, public health is stepping into the sphere, and the private medicine is starting to recede because it's not able to keep pace. And so the way I try and visualize this is, got a couple of maps here. So the one on the left is a planning map from the Emergency Medical Service, which was established just before the Second World War, which was basically about trying to run hospitals in a coordinated way in the interests, you know, in preparation for the Blitz and the damage that took place. And I've talked about that elsewhere if you're interested. But it basically shows in many respects that the red hospitals are municipal ones, the local authority ones that have been taken over and used, mainly these big sites for treating potential casualties just in advance of the Blitz. Then you've got municipal hospitals that aren't part of this emergency medical scheme in green. You've got the voluntary hospitals, which are the ones like the image I just showed before, the Royal Southern Hospital, but also the Royal Liverpool Infirmary. Many of the big named hospitals for the city of Liverpool, those are the ones in blue. And then the yellow ones, which there's a handful just around the city centre, they're the ones that aren't included in this emergency service. So there are some that are seen as too small or specialised to be involved. So that gives you a sense of those kinds of health changes. The other map is important because it shows in many respects that the housing function of the medical officer is also massively expanded, because this is the time when you have the big estates of Longview in Huyton, Knowsley, Norris Green, Speke. But you've also got planning in the post-war period for places like Halewood as well. So this is a time, kind of the peak of public health as a bigger concept, and it's rooted firmly in the city of Liverpool and rooted firmly in local government. So what happens next in many respects? The National Health Service on the 5th of July 1948 comes into being. The reason I've got this very boring diagram is to show, in effect, what this kind of just before the Second World War peak of public health happens after the war. You've got the Executive Council, which is responsible for running GPs. You've got in green the Regional Hospital Board, which takes over responsibility for all of those hospitals that I mentioned a moment ago that are being run by the local authority, places like Sefton, Newsham, Walton, Mill Road, those kinds of places. And then in blue, you've got the big teaching hospitals, those that are taken, and they have their own separate management structure. And you'll see that all that's left of public health is this tiny little strip of red, and they're left with a rump of small services like health visiting, district nursing, and the ambulance. So in many respects, the National Health Service, while it creates this universal system of health services free at the point of delivery for everyone in Britain, from a public health perspective, it's a huge loss because the focus really shifts away from these broader determinants just to hospitals. And here again, just to try and have a sense of the local geography, this is a map of the organisation. So if you look on the previous slide, the numbers listed in Roman numerals correspond to the map here. This is how they're carved up, hospitals, groupings across the Liverpool region. And it just shows that in Liverpool, it cuts across you can see sort of the hard lines, the local authority boundaries of Bootle and Liverpool, that it's almost a bit of a fudge from historically where they'd always been run by the local authority and the city council and the public health department to this new governance structure. So it doesn't even kind of fit or overlap within the city of Liverpool. This map also gives you a sense of the sheer number of hospitals there are in Liverpool, Birkenhead and on the Wirral. But it also doesn't show all of them. So if you remember the one that I showed briefly in blue of the big teaching hospitals like the Royal and the Southern, they're not even shown on this map because this shows just those for the Regional Hospital Board. So there are even more hospitals within the city of Liverpool that sort of fall under this. So what happens in the period between 1948 and 91? A lot. And if you're interested, I'm writing a book about the period between 1978 and 1996, due to be published hopefully in a couple of years' time, fingers crossed. But a number of things happen. So I've got here some big dates within the city and things that matter, and a map here of Fazakerley. And I've chosen this is because on the previous map you'll have seen Fazakerley sort of popping up as a very small hospital in the north of Liverpool, and it was a number of hospitals on one side. It was a tuberculosis sanatory for one bit on one part of the site. It was also an isolation and tropical diseases hospital linked with the School of Medicine for a period of time. And this kind of old Victorian Edwardian edifice is completely transformed by this new, very modern image of what health should look like, and it's very concrete driven, as you might expect, but this is what the idea of modern health looks like. It's not the old image of public health, it's very much hospitals. And Liverpool again is at the forefront of a lot of this, because there are a number of national changes about new hospital funding, about reorganising how health services are done, and these whole structures of management. But what they effectively do is they build up a whole new set of experts, professional figures with a whole new range of forms of expertise, but none of these are public health, and they're all pushed to one side. So while you've got new administrative and management and financial and supplies, organisation, medicine, the medical specialisation, a whole range of people that are employed by these new NHS structures, public health is pushed completely to the side within them because it remains within local government. So I love this image purely because it's the Fab Four sat on the front of Liverpool before they make it board, just as they're starting to break big in the early 1960s. But for me, it shows the real contrast of Liverpool during this period and kind of challenges that they're facing. But on the one hand, it's kind of the Mersey beat. It's not only national, it's international. Everyone knows the city of Liverpool. It kind of carries this cult status and image across the world, and it's kind of the beating heart of the swinging 60s in many ways. But on the other hand, if you look where they're sat, this is in central Liverpool, that it's a decaying city, and this idea of managing decline means that there's a real mismatch all of a sudden, is that before, when public health was responsible for the whole people of the city of Liverpool, it could act in these new areas. But you've got this division where there's a focus on what hospital services are doing, and then there's the city left to its otherwise own devices, and the kind of big redevelopments that are taking place, the things that Aidan briefly talked about, so with the photographs, these whole swathes of modernisation, they're starting to take place in the city of Liverpool, but they're divided. That what the people of Liverpool are experiencing versus what the health services do are very much two different things. So more recent times, this again is just to try and group what happens. Basically, is again the reason I kept the same colours is just to show that the yellow is responsible for GPs, primary care, the red is the public health bit, and again the big green is hospitals. So this is the new NHS, where it's divided in two between purchasers, people who buy care, and providers, people who give care effectively. So it splits the NHS in two, and this is still very much the structure that's in place today. And what I've used, the kind of dotted line of the in-between bit, the regional bit, is to show that there's a real tension that during the period I've just talked about, you had these new structures being built, new organisations, new forms of expertise. There was a real investment in health and what the NHS was doing. But after the 1990s, it goes in the other direction. Things are sold off, things are pushed away. The hospitals are treated as individual units rather than parts of a whole. That these forms of expertise are pushed further and further away. And that's kind of the real message I want to convey, is this: if you imagine the post-war period as a period of building up expertise, after the 1990s, it really starts to sell it off and push it away. This doesn't just take place under the Conservative government, which was John Major in 1991, but it carries on under New Labour. And the reason I've got just this series of pieces of legislation is each of these was a major national reform of the National Health Service that had a bearing on the organisation of the city of Liverpool. And you can see that before, there weren't that many. So back in the post-war period, there were 3 in the space of 40 years. And here, in the space of 12, you've got, gosh knows what, 7, 8. It just shows the kind of pace of political intervention and churn that starts to take place. That if the NHS was a political football before, and it certainly was electorally, then in terms of how it's run, it really intensifies into the 1990s and the 2000s. And so I've got these images not just to embarrass Professor John Ashton, but because also to show that Liverpool, again, is a pioneer in kind of providing a new way of doing this. So in the 1980s, the 1990s, Liverpool is the start, or the birthplace of new public health, just as it was of old public health. So I was talking about this mismatch between what hospitals and the NHS do and the health of the people of Liverpool. John is one of those few people who try to bring them together in reimagining how things should be done. And he does this by starting the Liverpool Public Health Observatory, by starting things like syringe and needle exchanges for drug addicts, for things like AIDS support and direct intervention when it wasn't really known on the national scene. That he's a real figure in pushing for these issues locally. And Liverpool, again, has that kind of fruit bearing in a way that you don't really see in other places. But crucially, John is able to latch on to these big NHS structures and do something about it in a way that in the later period, in the 1990s and 2000s, it becomes a lot more difficult to do. Just got this map, just again, it's trying to illustrate that, I've got the image of Mersey Beaton, this kind of declining city on the national stage, is to show that deprivation is still a big issue in Liverpool. And I've got the sort of the image of South Sefton to show that real discrepancy between, declining old inner Bootle, even in the 1990s, Liverpool and the rest of the quite, the affluent suburbs and Mersey region. So it's showing that, again, that despite this investment in Liverpool's hospital services and the reorganisation that takes place, it hasn't had a bearing on health and health outcomes in the way that an older public health approach used to have. So that's the kind of more recent history. It starts to get worse from the sort of period of election of Conservative government in 2010, because if things are all about selling things off, removing expertise in the NHS, it kind of enters a new, from first or second year to fifth under the Conservatives. And this Secretary of State for Health, Andrew Lansley, introduces a clause about making providers open to anyone. So if you're an organisation, whether you're Virgin or whether you're an American multinational, you can provide health services in Britain in a way that That wasn't open before, that the whole thing is about competition to try and improve efficiency. So what does this mean? So in Liverpool, I've just got kind of a brief bit here, that you've got the abolition of a major numbers of NHS expertise, which in the context of a pandemic are irreplaceable and they would have been invaluable. So local public health expertise that remains is gone, is taken away completely with the abolition of the organisation. This kind of big, meaty subnational government, the regional strategic health authority, is abolished, and the power that they have is gone. The Health Protection Agency, it does become Public Health England to a certain extent, but its main functions of doing things like providing laboratory services, they're all sold off. And this is part of a range of measures that basically mean that the family silver that constitutes the NHS's expertise, not just its kind of capital and hospitals, but the people who work in it, is sold off in many respects. And so I've got on the other side, you can't really see because of the zoom bar, but mergers that take place. And the big one obviously is the Royal and Aintree that start to merge, but also you've got the short-lived Liverpool Community Trust, which I'll talk about briefly in a second, but also Calderstones, which is a mental health organisation or NHS organisation run in central Lancashire. And this is taken over by Merseycare because effectively it's not viewed in place, you know, this classic public health about thinking about people. It's because it's run as a business model effectively about one NHS organisation taking over another. So please don't read this in laborious detail. I realise I'm running out of time to do this, but effectively the bit I want you to read of this quote is that this is the opening bit of the report, the investigation into the failure of the Liverpool Community Trust, and it says that in setting infeasible financial targets, it damaged patient services. And if there's anything that's more of an indictment of how the new NHS is run, has been run since 2012, it's this. It's that the Community Trust was set up with the view just to improving its financial outcomes rather than those of patients and the people and city of Liverpool. And it shows you just how far removed things were from Duncan's kind of approach over 150 years ago. So I've tried to shoehorn a bit of the European dimension in knowing the audience. And the thing that you're probably going to encounter most in this form is that a lot of organisations like UKIP or even some of the conservative sections of the British Medical Association see a potential in Brexit. They say it's going to unleash the ability to invest in the NHS beyond the kind of, you know, joke that was £350 million inside of a big red bus. Because in Britain, until they left the European Union, the health policy was governed by competitive and commercial law rather than health law because of the way it was contracted out since 2012. And if you read some of the things these people say, they will say that this is because of European legislation and this is something we can be free of. None of that is true, as you might expect, because the reason it's subject to competitive commercial law is because it's been allowed to be. So no other European Union member state is subjected the same way. It's because Britain has preferred to enter that in order to get an open market to the NHS, to make it a more commercially viable entity to attract people to provide rather than necessity. So whilst there is technically some truth that yes, it was subject to a different form of European law than other European member states, that is a direct political decision of the Conservative government from 2012 onwards. So that could have been averted previously, but it was a political decision not to do so. So what am I trying to say in all of this? So I submitted evidence to the Coronavirus Health Select Committee in April last year. It's about a year ago since I wrote this. And I said that there are clear historical lessons that need to be borne in mind when thinking about what to do next and how to think about changing approaches to health so that the disastrous fatality, mortality and morbidity rate with long COVID that we've had in Britain doesn't happen again. And I said that you shouldn't hollow out this regional expertise, you know, that I was talking about, that it was built up in the post-war period, then sold off. I've said that this is an enormous problem and it's been exposed by the pandemic, and you need to have strong, robust, place-based organisations that are responsible for people. I also said that public health has been completely marginalised since 1948, and that needs to be readdressed in thinking about these wider determinants of health. And I also said that constantly changing the organisation does nothing for it, because people leave, people move into new roles, expertise goes, that when a major international pandemic does wash over Britain and the National Health Service, it's not in a position to fight it because they're looking at the next organisational change. There's been an NHS white paper announced a few months ago or 2 months ago, and it has done none of these things. In fact, it's done the opposite. It's strengthened centralisation, as has been the case throughout the pandemic. It's further reduced public health by cutting its budget and changing the Public Health England into a new organisation for health security, and it's introduced another set of reforms in the middle of a crisis. So I would say the impact for the people of Liverpool is potentially quite significant, but also that the government haven't heeded the lessons of history, and this is a significant problem that is just going to exacerbate the situation rather than try and ameliorate it. So I'm sorry I've had a bit of a rush through in 30 minutes, but I hope that gives you a real sense of Liverpool's place, health services, and why the pandemic has hit Britain, the city of Liverpool, worse than most other places.